According to the World Health Organization, the definition of maternal health is the health of women during pregnancy, childbirth, and the postpartum period. In South Africa, 4,300 mothers die each year due to complications of pregnancy and childbirth. Despite high coverage of prenatal care, the challenge of HIV and AIDS and inadequate implementation of healthcare is responsible for the loss of lives. According to AmnestyUSA.org, high pregnancy rates in South Africa are due to the lack of privacy and patient confidentiality in clinics, especially around the implementation of HIV testing during prenatal care, lack of information and knowledge about sexual and reproductive health, and problems relating to the availability and costs of transport. Experts suggest 60% of maternal deaths in South Africa are avoidable. Timely prenatal care is especially important. The World Health Organization recommends a minimum of 4 prenatal care visits, starting in the first 12 months of pregnancy. Early prenatal care connects women with the healthcare system in South Africa, which results in the increased likelihood of delivery with a skilled birth attendant for 20 weeks of pregnancy by the year 2016. Fortunately, prenatal care is free in South Africa's public healthcare system. Early attendance at prenatal care clinics is important for pregnant women and girls living with HIV. Nearly 30% of pregnant women and girls in South Africa are living with HIV, and illnesses related to HIV infection are the biggest cause of death among pregnant women in South Africa. Women and girls living with HIV are over 5 times more likely to die during pregnancy or shortly after birth than those without the virus. In 2010, the South African government began providing antiretroviral treatments to pregnant women and girls living with HIV. As a result of these ARVs, the rates of maternal deaths has begun to decrease. The transmission of HIV from mother to child has decreased from 70,000 to under 8,000 within the last decade. The South African government provides mothers with child grants of 300 Rand per month. In townships, the rates of pregnancies seem to increase due to men impregnating women purposefully in order to receive these 300 Rand. In South Africa, there are many options for childbirth. An expecting mother may choose to give birth at home or in a hospital. The hospital may also vary from private to public. While home births do occur, they are much less common than hospital births, so we will focus on the differences between private and public facilities. Mothers who give birth in private hospitals must pay for the care out of pocket or through medical insurance. Typically, private hospitals provide better care and have higher trained medical staff. Unfortunately, many people cannot afford private health care. These patients are forced to seek help from the public hospitals or go without care. Public hospitals tend to be overcrowded and are unable to provide appropriate care to all patients. In addition, many women claim to be mistreated and abused while being treated in the public hospitals. The expecting mothers may be ignored, left unattended, or discharged too early without proper medication. Some medical personnel also verbally abuse women about their sexual habits. Mothers who are HIV positive typically experience the most abuse. The inability to afford appropriate care, the mistreatment of women in hospitals, and the large divide between public and private facilities has been detrimental to the goal of improving maternal health. In order to decrease maternal mortality rates and infection, these issues must be addressed. The main issue of transmission of HIV from mother to child comes from breastfeeding, where each year an estimated 150,000 infants are affected with HIV through breastfeeding. The vast majority of these transmissions occur in under-resourced settings, such as in South Africa. Breastfeeding is a well-recognized significant route of mother-to-child transmission of HIV. The World Health Organization recommends that where replacement feeding is acceptable and safe, it should be used, but HIV-infected women should avoid breastfeeding altogether. However, in many low- and middle-income countries, these criteria for replacement feeding are not met, and breastfeeding remains the only option available for HIV-infected women. HIV and AIDS is still the #1 cause of death at 33.2% in South Africa. But in children under 5 years old, the main causes of death are HIV and AIDS at 17%, acute respiratory infection at 16%, and prematurity at 14%, and birth asphyxia at 9%. In 2010, 30.2% of all pregnant women who attended public sector healthcare facilities were infected with HIV and AIDS. In 2011, an estimated 70.4% of maternal deaths in South Africa were associated with HIV infection, as were half of all deaths associated with children under 5 years old. The success of programs associated with mother-to-child transmission of HIV is crucial to help reduce mother and child mortality rates. Every year in Africa, at least 125,000 women and 870,000 newborns die in the first week after birth. This problem of high mortality rates amongst mothers and children poses true in South Africa as well, where the maternal mortality ratio is approximately 150 deaths per 150,000 live births.